why people go on birth control in the first place, what some of the side effects could be that you maybe don't realize. We'll move into what happens if you choose to go off of it and what to expect, and then moving into menopause, like what to even expect if you go off the pill once menopause begins. So the first question I have for you is, let's just briefly touch on what are the conventionally prescribed types of birth control that are out there right now?
So basically, you have so many different types of what they call biphasic. So both having estrogen and progesterone type birth control pills. And then you also have progesterone only. And so some women are prescribed progesterone only pills because if you have a history of migraines, you're more likely to get a blood clot. So typically these women will be prescribed progesterone only, or also if they have a history of different conditions that are associated with estrogen dominance, say, for example, PCOS, they might be given a progesterone only pill. So that's basically all your oral pills. And then you also have hormonal IUDs. You also have your copper IUD, which has no hormones, and then you have things like Mirena, patches, also the NuvaRing. So there's a wide variety of different options for women.
Okay, that's a good place to start. Patients that you see, what are they mostly on? Are they taking more oral contraceptives, or have they gone other routes like IUDs or patches? What do you mostly see?
I've seen a mix. I've definitely seen women, maybe they were on the pill for a while, then they switched to the patch. I've also seen patients that have used NuvaRing. I've been seeing more and more women on Mirena. In fact, actually, I've seen women, like, by the time they see me, they're on their third Mirena. So I wouldn't necessarily say that the majority is it's really been a mix.
What do you find most women were prescribed birth control to start? Why were they prescribed it to start?
Most of the women I've seen in my practice, definitely, they started quite early, maybe between 13 and 15, and mostly was because really heavy, severe periods, horrible cramping. That seems to be the most common. I definitely have some patients they just decided that was the form of birth control that they wanted, meaning a way of preventing pregnancy. But I'd say the majority are definitely on that spectrum.
So as a naturopathic doctor, looking at the core reason for why a teenager would experience a menstrual cycle with painful periods or heavy bleeding, what are the causes of that? And is it fair that birth control is used to help alleviate those symptoms?
So, the big factor definitely when we're looking at heavy painful periods is estrogen. And so most commonly it is caused by some sort of estrogen dominance. And there's so many different reasons why a woman might have estrogen dominance. One, it definitely can actually be a factor of diet. So, one, we have what we call xenoestrogens. So these are estrogens that are coming from outside the body, which are found in a lot of plastic products, unfortunately, and a lot of non-organic products. So that's one component. Definitely also just when we're thinking about liver detoxification. So we process all our female hormones through our liver. And if we're drinking too much alcohol, or again, because we live in a very toxic world, if we're not doing enough to support proper liver functioning, you could also result in excess estrogen. Another big factor is actually stress. Why? So when we talk about estrogen dominance, what we're really talking about is the ratio between estrogen and progesterone. So if progesterone starts going down in comparison to estrogen, you're going to have an estrogen dominance picture. And why stress plays a role in that is that actually progesterone is used to produce the stress hormone cortisol. So if you think about it, if you're constantly in times of stress and your body is using your progesterone to make cortisol, naturally the progesterone is going to go down in comparison to the estrogen. So that's another big factor that would be causing more of this estrogen dominance pictures. But then there's also another thing that should always be ruled out when there's really heavy painful periods with a lot of cramping, and I have seen this in my practice, is endometriosis. So it's also important to rule out some of these types of things, and also other things that can cause heavy painful periods is fibroids. And to get back to your question about you were saying about whether or not treatment. So
yeah.
One of the important things is always like considering like the welfare of the patient, and it does take time to get periods normalized, and specifically when it comes to if it's specifically you're working with more of like an endometriosis picture or fibroids. So it does involve a lot of changes, both dietary, there's a lot of different herbs that have to be taken. So if the patient isn't really ready for that state of change, it might be appropriate at that point. If they're in a lot of pain, or if the bleeding is very, very heavy, that perhaps, possibly, birth control might be the only option at that point. But overall, if a patient is really ready to make some of these changes, birth control is not necessarily the best solution for them.
So these changes that you recommend for someone whose estrogen is high, whether it's because of endometriosis or fibroids, or because something in their system is increasing their estrogen or decreasing their progesterone, there are dietary and supplemental things that they can start to include in their diet, and then I'm also assuming some things need to be excluded.
Exactly, yeah.
For them to start to balance that hormonal imbalance. Is that right?
Oh yeah, absolutely.
Can you give a little bit of an example of something that someone would want to incorporate more of, maybe in the herbal realm or in the dietary realm?
Well, the dietary, definitely one, cutting out the main offenders. So definitely reducing, if not cutting out alcohol. I know that's really hard in New York City because people really, really like to drink, but typically I'll usually recommend, specifically if we're talking about something like fibroids, for the woman to not have more than one drink per night and no more than 2 to 3 times a week, definitely, because we really, again, we want the liver to be functioning really, really like at its max. Another big thing is like dairy products. So and I'm talking about animal dairy, goat, cow, etc. So basically animal dairy is used to feed baby animals, and it's chock full of hormones. Even if you're using the most organic, beautiful, maybe you literally milk the cow yourself, it still has a lot of hormones. And so when we think about balancing hormones, the last thing we want is more xenoestrogens and these outside hormones. So definitely dairy and alcohol, and really keeping refined carbohydrates and sugars at a minimum, more kind of thinking almost like from a PCOS or PCOS picture. As far as veggies or other foods to really incorporate is your brassica vegetables, things like cabbage, broccoli, kale. And the reason being is that they are very high in this compound called indole-3-carbinol, which is basically what it does is when our body is processing estrogen, it helps to make the metabolites, which are basically the end products of the breakdown of estrogen, more favorable. So that's one really important thing to definitely to incorporate. And for people who maybe they don't like eating, I typically usually will recommend a patient to have about the equivalent of a pound of these vegetables. I mean, that sounds like a lot, but it's only actually about 2 to 3 cups a day. But, another option would be actually just taking either indole-3-carbinol or DIM, which is basically a derivative of indole-3-carbinol, works wonders.